All right, team. Good morning. Anucci, we saved you a seat up here, buddy. Um, it's a pleasure to stand in front of you guys today and welcome our visiting professor, Dr. Anthony Riccio, to CHEO to give our combined grand rounds for surgery and pediatrics. Um, You'll be talking today on anchors, admirals, and a-holes, and you'll understand very quickly that this is a very fitting talk for Dr. Riccio. And I've had the pleasure of doing fellowship at Scottish Rite with him, along with Dr. Tice. And Dr. Jarvis is also an alumni from Scottish Rite. Dr. Riccio is a highly experienced pediatric orthopedic surgeon at Scottish Rite Hospital for Children, formerly known as Texas Scottish Rite Hospital for Children, and a lot of other formerly known nomenclatures for the hospital. But it's definitely one of the world renowned and kind of very prestigious fellowships, and really provide world class care for pediatric patients with musculoskeletal diseases. He's the director of the Center of Excellence in Foot and Ankle Disorders, and has had a significant contribution to medical education to both residents and fellows. He holds academic appointments as a professor in the Department of Orthopedic Surgery at UT Southwestern Medical Center. He's adjunct professor in the Uniformed Services of the Health Sciences. He completed his undergraduate studies at Dartmouth College, earned his medical degree in Georgetown School of Medicine. He trained at the National Naval Medical Center in Bethesda, Maryland, and completed orthopedic surgery residency at Georgetown. He further specialized the fellowship at the Scottish Rite, and he was so good that eventually they brought him back to run his trauma team, and now running the foot and ankle deformity. Dr. Riccio, his professional interests include pediatric orthopedic trauma, medical education, and pediatric foot and ankle disease, and he has a very keen interest in beer pong, and we've experienced that as well. And so thank you, Dr. Riccio, for being here with us today, and thank you for all of the education that you've provided us. So thanks. I'll turn it.
If only I could get up here and talk for an hour on bear pong, I think we'd all be happier. But I guess I have to thank, I guess the title of this talk had to get run through Jay Jarvis. So thanks for approving it. I heard it was a little controversial. I appreciate you letting me keep my talk. Not every place where I get asked to do this talk lets me keep the title. So I knew you guys were just cooler in Canada. I knew you were. Disclosures are at the bottom, and people always like to kind of start with their disclosures. It's not, how do I advance? It's not advancing. What do I have to do? Oh, just move it, and now I can click? Technically challenged. No? So, okay, now I just hit that button.
Arrows are good.
So these are the real disclosures when you give a talk like that, when you're kind of talking about it. It's one of these life journey talks. You know, when I think about my time in the Navy, first of all, I'm really not sure that kind of what I learned and did is really worth reviewing. For those of you, and I know this doesn't really apply to a Canadian population, whoever might be considering joining the military for financial gain, I wouldn't emulate anything that I've done. And even though things kind of worked out pretty well for me, I'm not entirely sure I'd do things the same the second time around. The other thing it's worth mentioning is that, you know, when Tice gives you a call and says, hey, we want you to give a talk, but, you know, it's combined, it's peds, it's general surgery, you know, don't talk about orthopedics, just talk about something in your life. In general, what I've learned is that when people kind of ask you to give talks that aren't clinical, it means you're either getting old or you've lost any credibility whatsoever discussing real medicine. So thanks for, you know, really driving that spear through my heart, buddy. But it's okay. It's okay. I guess I am getting old and I may be losing my credibility. So you tell stories like this, and I'm reminded of Through the Looking Glass and Lewis Carroll, and you think back on something, where our paths began. We were talking about where Ken's path began last night as a waiter, serving Dr. Willis, and I'm reminded of Lewis Carroll and the King of Hearts, and when Alice was lost and was trying to relay her story to the Queen, and he said, "Stop, just begin at the beginning, go on till you come to the end, and then stop." And it's a great way to frame things when you think about stories like this. And for me, this was the beginning. Does anyone travel down to the East Coast of the U.S.? Anyone know where this is? You're nodding your head. Do you have any sense of where this is? Sherry, come on. Yeah, it's close, right? It's recognizable. This is Narragansett Beach in Rhode Island. This is it's a beautiful beach, town beach, overlooking some old towers there and an old Coast Guard house. And this is a really special place for me. This is where I caught my first wave. I'm a surfer. It's where I kissed a girl for the first time. It's where I drank my first beer when I was 13. It's where I was arrested for the first time. Spent my first night in jail from that beach as well. And it was sitting on this beach on a very kind of cold December evening where I was really having a debate with myself. And the debate was, should I join the military because I'm broke and I have no way to pay for medical school, and I knew I was going to medical school. And as I kind of was processing through this, because I used to go to this beach to think a lot, it was very Machiavellian, Niccolo Machiavelli, right? Ends justify the means, right? And it was a Machiavellian debate I was having with myself. It was very self-centered because in truth, I had zero patriotism, and honestly, I have less today than I did back then with what's going on in my country. I had no military fantasies. I had no drive to be leading 100 guys over a hill shooting guns a-blazing and whatnot. I had zero sense of adventure. I had no ability to follow rules, and I still don't, unfortunately. And you wouldn't know it by looking at me now, but I had an absolutely glorious head of hair, and in no way did I want that cut. The problem is I also had no money. And I was very acutely aware, sitting on that beach, of how little money I had because I had just lost my job. And the reason I lost my job was because of an Italian grinder. All right. In Rhode Island, we call these things grinders. You call them submarines, hoagies. I don't know. What's the term here? Sandwich? What do you guys use? Sub. Italian sub, right? Italian sub. Everyone's had an Italian sub. It's the best sub out there, right? You got your Genoa salami. You got some super sod. You got provolone. You put a little olive oil on it, some banana peppers, fresh bread. It's absolutely delicious. I can make an unbelievable Italian sub, and the reason I can make an unbelievable Italian sub is because I worked as a short order chef behind a gas station making Italian subs and other submarine sandwiches, and I got really good at it. And I was very proud of my Italian sub. And one day, working in the back of that gas station, actually that day in December, one of these really annoying fat kids, kind of maybe 12, maybe 13, kind of the ones that watch a little too much TV and are a little too precocious. And he walks up to my counter and he slaps his fat belly and he says, "I want an Italian grinder." And I was like, "It's Italian. It's not Italian. We don't really say it that way." And he was like, "Ah." And so I was like, "Yeah, okay, kid, no problem." And so I get the fresh bread and the olive oil and the super sod and the Genoa salami and the provolone. I make him the best Italian sandwich he's ever going to have in his entire life. And I wrap it up and I give it to him. And he opens the wrapper and he pushes it back at me. And he says, "No, I want an Italian grinder." And I said, "This is an Italian grinder. It's got salami and super sod and provolone. This is what an Italian grinder is." He said, "No, it's got meatballs in it." And I was like, "No, a meatball sub has meatballs, but an Italian grinder has provolone and super sod and Genoa salami and mortadella and etc." And he insisted that I make him an Italian grinder with meatballs in it. And I told him no. And he told me I was not doing a good job at my job, at which point I told him exactly where he could shove his Italian grinder, and he went to his father, and I was immediately fired, jumped on my motorcycle, drove to that beach in Narragansett, Rhode Island, and started stressing about how I was going to pay for med school because I just lost my job. And that's how it all started for me. Like, I was literally broke. I was pissed off at a fat kid, and I was totally in it for myself. I just wanted someone to pay for school because I didn't have any money. And so I joined, and you go to med school, and somewhere along the way, you're commissioned, and they turn you into a lieutenant, and then they turn you into a lieutenant commander. And I was at Georgetown for med school, and it was awesome. And they had this awesome orthopedic surgery department. It was world class. The education there was insane. It was my dream once I got there to really like become a part of it. And I was really lucky because I was handpicked. I was handpicked out of 27 kids who wanted to do orthopedics, guys and gals, to stay on. And literally outside of the match, just you apply here. It's the only place you need to apply. We're going to bring you in. You're going to be all set. You're going to be part of the real Georgetown orthopedic family. And I was so honored, and it was like a dream come true. And so I said, absolutely. And that's what we did. And so I was on my way, headed to do exactly what you guys all wanted to do, what your dreams were one day, at least my orthopedic friends. But ENT, you pick what you will, right? Like, it's what you want, and all of a sudden it's there. And med school was paid for by the Navy too, so I wasn't in debt. It was like life was perfect. But I joined the Navy. And before they allowed me to go and do my, who else is old enough where you had to do like a general surgery like internship, right? I know you are, right? You are. The rest of you guys, not even you, you didn't have to. Oh, you're young. Oh, Jesus, the chief's young. All right, so a couple of us in this room, you didn't do 5 years of orthopedic surgery or ENT. You had to go be a general surgeon first. And when you're a general surgeon, you were owned by a general surgery department. And so it didn't really matter where you did your general surgery internship as long as you had your residency to go to afterwards. So I was called by the Navy and say, hey, we know you matched at Georgetown, you got your orthopedic spot, but we need you to do your general surgery internship up at Bethesda. It's just up the road, National Naval Medical Center. Someone can't report, you're the closest because you're 4 miles away. We're going to have you do your internship up with us. Don't worry about it. It's going to be perfect. You just do general surgery, you head back, do your orthopedic residency, and then we'll sort everything else out afterwards. And I was like, cool. Flagship of Navy medicine, cool place, peacetime. I'm not going to get sent anywhere. Plus, I'm an intern, and you can learn generals. You can learn how to do lines and examine abdomens kind of anywhere. So I didn't think that was too much of a problem. And so I went to Naval Medical Center, whatever, it was fine. It did a good job but was still super excited to get back to what I really wanted to do, which was orthopedic surgery. And, come somewhere around early November or so, I got called into the office of one Captain Miller. Captain Miller was the head of the Graduate Medical Education Board for that hospital. That's the person who decides is like if you're an orthopedic surgeon in the Navy, well, you're gonna go work here, you're gonna go work there, or we're gonna allow you to train in hand and you to train in joints. It's a really important job. He only answers to a board that's in Washington, D.C. that's higher. And I called into his office and I'm like, okay, this is gonna be my paperwork to get back to Georgetown. We're gonna settle it all out. It's gonna be great. And he said, hey, Tony, I got good news. And I was like, good, I've been waiting on this because I was a little nervous here. He's like, you're going to Okinawa. And I was like, oh, really? Just for an experience, just to like go to the hospital out there? Like, that's cool. And he said, no, you're going to go to Okinawa next year and you're going to be there for 2 years. And then you'll just be a general medical officer. And then if you do a good job, we'll let you come back and reapply to orthopedics, which you can do in the Navy. And I said, no, I'm going to Georgetown. I got this whole Georgetown, it's all lined up. I'm already going to be an orthopedic surgeon. It's all set. And he said, no, you have orders here. And if you have orders, you can't break your orders. And I've got your orders. And he handed me the orders. And I said, no, you don't understand. I've got an orthopedic residency at Georgetown. And he said, orders trump everything. I'm sorry, but you can always reapply to orthopedics after you spend a couple of years in Okinawa. And just like I made the mistake with the sandwich, I told him exactly where he could shove his orders. And I got in a lot of trouble for that because you can't do that in the Navy. And when you do something like that, it goes up to the Admiral. And my punishment was I had to pick up trash in the United States, Thanksgiving is on a Thursday. Most people get Friday off, but my punishment was I had to pick up trash around the hospital on that Friday after Thanksgiving. And I was out there picking up trash, and I was like, man, I hated the Navy. I hated it so much because they took everything I wanted away from me. I hated Okinawa. I hated myself for thinking this was a good idea in the first place. I still hated the fat kid who got me into the whole predicament, right? And I was despondent. But I wound up picking up trash with the chairman of the orthopedic surgery department, who was also in trouble because he was a fairly irreverent guy. He was well known in the sports. He was well known in the sports world way back when. He was the guy who reconstructed Bill Clinton's knee when he had an ACL reconstruction, and he's still kind of known in the sports world. And he was the only other guy out there picking up trash. And we're picking up trash together, and he strikes up a conversation with me. I knew who he was. He didn't know who I was. And he kind of was like, why are you out here? And I told him the whole story, and he was like, that's bullshit. And I was like, yeah, it is, right? Like, this is ridiculous. And he was like, you know what? He's like, I've got a couple connections in the orthopedic. I think I can go above Miller to that board up in DC. I bet we can sort this out for you. And I was like, well, I feel like one of us is going to get in a lot of trouble for that. He's like, I'm already in so much trouble, it doesn't matter. Let me see what I can do for you. And literally a week later, this comes across my desk. Now, this is a really important document for those in the United States military, okay? This is called the DD-214 form. Take a look. That's my name up there, Anthony Riccio. Discharged from active duty, released from active duty, and there's the little thing at the bottom that says DD-214. As soon as I got this form, I was literally separated from the Navy to be allowed to do my orthopedic residency. And this guy made it happen in a matter of 2 weeks, shifting through the bureaucracy of the military. Now, I go to Georgetown, I do my residency, whatever, it's great, right? I go to Scottish Rite, where these guys train, where Dr. Jarvis trained, amazing, right? You meet phenomenal mentors, and people teach you, and they love you, and they care, and they build you up as a pediatric orthopedic surgeon, and it was wonderful. And I did that fellowship, and then it was time for me, after that, to finally serve the time I owed. I owed 4 years. They paid for 4 years in med school. I owed 4 years. My time was up, and I got stationed, which was perfect because I'm a surfer, in San Diego at what was called the Starship of Navy Medicine, Balboa Medical Center. Great place to be stationed, great place to spend a couple of years. And I remember walking in to go to put myself back on active duty with my little paperwork and my uniform that I didn't really know if I was wearing right at that point. And I was walking up through the gates, and I was thinking about Captain Miller, and I was thinking about how the Navy had hosed me, how much I felt slighted by them after I'd worked so hard to do ortho, and they almost took it away from me. And I was trying to think of how I could turn this into a positive experience rather than just being mired in this misery from back in Bethesda. And so, I had this great mentor, and many people in orthopedics have crossed paths with this guy, but he's not a big academic. He's just an amazing educator. His name's Jack Delahaye. And he was my mentor, like a father figure to me in residency. And I had called him the night before. He's like, I don't know, I feel like I'm going into this with the wrong attitude. And he said, just Tony, remember what you're there to do, and very much in a Delahaye way, and don't be a dumbass about it. And I was like, all right, well, thanks, Jack. That's really helpful. But, I think when it comes to not being a dumbass, that's a really important thing. We should challenge ourselves with doing that more than we probably do. And I think when it comes to not being a dumbass, what you really need to find in yourself is what you're looking for, right? So I don't know, anyone read Conan Arthur Doyle here? Is anyone old like me, right? I love the stories, right? Silver Blaze, it's a short story, Sherlock Holmes. It's about a horse. It's about a racing horse going to win. And a lot of people are betting. There's a lot of money on it, and the horse goes missing. And Sherlock Holmes, of course, is called on to the case, and he even slips some bets in there because he knows what he's about to do before he solves the case. And he cracks the case wide open when Scotland Yard was useless, and he cracked it open because he found a tiny little burnt out candle out in the yard where the horses trade, and and the case is wide open, and the horse comes back, and the horse wins, and of course no one else had bet, but Sherlock Holmes bet a lot, made a ton of money on it. And Scotland Yard Inspector Gregory is furious and is screaming at Holmes. He's like, how did you solve this case? And he said, I found it because I knew exactly what I was looking for. And that's really, that always kind of resonated with me, right? We're more likely to find things if we're looking for them than just kind of wandering around aimlessly. And so when I went into the military, I was trying to think, okay, what was I looking for? How am I not going to be a dumbass? I have to define what I'm looking for. I knew I loved education. I still do. I knew I wanted to be as great an educator as I could and a mentor to people below me because I felt very privileged to have great mentors myself. I wanted to advance the care of Navy kids. I think anyone who goes into pediatric specialty just wants to take great care of kids. I loved research and I wanted to do it. And just like Ken, right? Like I was right where you are, man. I was coming out of my final time of training. I wanted to pass my boards. In the U.S., we take our boards after our fellowship, not at the end of residency. So that was really important to me too. And so these are the things I was looking for, and I carried them into the hospital, and I kind of went into my department where I promptly met the guy who was replacing in my first practice partner, a guy by the name of Jeffrey Cassidy. Who knows? I'm going to wander. Don't yell at me. I'm wandering. Who knows what this thing is? That's a Navy SEAL emblem, right? Jeff Cassidy, former Scottish Rite Fellow, maybe 5 or 6 years ahead of me. Prior to that was a Navy SEAL on Team 6, which is kind of the teams, the most elite team. He was so good at being a Navy SEAL that he became a Navy SEAL instructor. He was so good at being a Navy SEAL instructor that they wrote a book about him called The Prince of Darkness. You can find this. He was a very interesting individual, and I walked up and I introduced myself, and we had the Scottish Rite connection, right? So like he was and I was like, this guy's gonna be really intense, and he wasn't at all. He was a complete clown, like these pictures you see here. And he's like, all right, Tony, what do you want to do? What are you gonna do? And I said, well, I want to be a great educator. I want to do meaningful research. I want to advance the care of Navy kids. I want to pass my boards. And Jeff promptly told me, screw research. You're not going to do any of the cool surgeries you do at Scottish Rite. This is too bureaucratic a system. They're not going to support it. You're in San Diego. Just learn to golf and absolutely never join a committee. And I walked away. And I was like, I thought I knew what I was looking for. He immediately dispelled it, and then he just walked away. Then he just walked away from me. I was like, does he hate me? I don't know. He also told me residents aren't interested in learning anything, which immediately took away that desire too, right? And so, by the way, seriously, I mean, where is he? Yeah, okay, right? Like, come on. I don't understand. Like, are you a cardiologist? And around the neck too? I was apoplectic. Thank you to the rest of your class for not doing that. You should have one of those. I'm going to make fun of ENT. You should have one of those little lamps on your head too, like the old-fashioned lamps that the ENT guys did, right? Jesus Christ, a stethoscope. I still can't get over it. Well, listen. Learn to golf. You can't do any cool surgeries. You're never going to be able to do research, and residents don't want to learn anything. So, boom. Immediately, 3 of the 4 things I was looking for were knocked right out immediately within 10 minutes of me walking into that hospital. Fortunately, I wandered around the department. I ran into other people who disagreed. Mike Thompson, who was captain at the time, he was the program director, said, you know what? That's not true. You're never going to have more time to teach because we don't have to, we're not beholden to kind of civilian standards of when we have to get in early and just do a lot of cases and then go home and do our paperwork. You're going to have a ton of time to teach. Matt Proventure, who's fairly prolific in the sports world and was my partner for 4 years. You know Matt, right? Yeah, everyone knows Matt. Matt's a dear friend of mine. We were together the whole time we were in the military together. And Matt was like, he had it figured out. He was like, listen, you can get DOD research funding. You can get massive massive amounts of money just by asking for it, you'll be able to do more research than you ever can imagine. And no one knows this guy who's off on your right. That's Paul Gerard, who's the chief of trauma down at University of California, San Diego. He was a traumatologist I was working with, very gruff guy, and he was like, "Don't listen to Cassidy. Only you decide what cases you can and can't do, and if they tell you can't do them anyway and prove them wrong." And so, I thought there was a lesson there, right? Like as much as I love Jeff Cassidy, we really need to emulate those people who kind of embrace the positive aspects of their job. We have to build on what others started. Matt Provencher had inroads with DoD funding. It made it easy for me to do the same and do research. And like Paul Gerard, he loved doing hard trauma cases and he found a way to do it. I loved doing spine surgery at the time. I came out as a spine surgeon, Scottish Rite, and I found a way to do that. So you got to do what you love. This is how you're going to be happy for the younger people in your careers. They all, however, agreed you should never join a committee. That was pretty universal there, right? And I mean, so that I'll leave you with that. You take that home. And so, it was cool because I got to step back and I knew I was only in for 4 years. I signed up for 4 years. I owed them 4 years. There's no point in staying longer because I'm not going to retire because I'd have to stay in forever. And so I didn't have to worry about things like promotion. I wasn't going to get moved to another duty station. I knew I was going to be in San Diego for 4 years. I didn't care about becoming like politically a rising star in my hospital and rising in station and becoming like the director of surgical surgery or the surgeon in chief or the head of this or that committee. And I didn't really have to kiss up to anyone who had, plugs, who's had inroads with the military so I could get promoted from my small rank of lieutenant commander to commander. It just didn't matter. But just because I didn't have to think about that didn't mean that it wasn't a great opportunity to hone leadership skills. Honestly, the military is great for anyone who considers it because you'll never have an opportunity to lead at such a young age, right? There's so much turnover in the military. Young, energetic people can assume leadership positions that, in this hospital, you've been program director now for how long? A year and a half, but you're 10 years into practice. I was program director within a year and a half of coming there just because I loved education and it was a pursuit of mine. And so that was really cool opportunity. It was also the only time that I was able to lead exclusively in my area of interest because I didn't have to worry about this. I didn't have to say I don't know, become the chair of the OR safety committee or something like that. I loved education. And I was allowed to, is that a thing? You guys got that? Everyone's got that, right? I mean, it's a very irritating committee, by the way. Don't join any committee, but especially don't join that one. Oh, you're the head? Now I know it's bad. Now I know it's a problem, right? But, but, but the great thing is when you don't have to worry about things like this, you don't have to engage in things that aren't desirable. You can just lead in what you want to do, and you have an opportunity in systems and any system, right? I'm talking about the military, but this is applicable to CHEO. This is applicable to anything. To learn from the best people who really knew how to lead. The guy on the left, that's Bruce Gillingham, 2-star Admiral, highest ranking orthopedic surgeon ever in the United States military. He was Surgeon General of the Navy. He's a pediatric orthopedic surgeon, by the way. I don't know if any of you have interfaced with him, but he was a mentor to me when he was just a commander and I was a medical student, and he was back there as the head of medicine for the Pacific Fleet stationed in San Diego. And this is a guy who knew how to work the bureaucracy, right? Everything's a horrible bureaucracy, and the people who become successful sometimes are the ones who just know how to weave in and out of that bureaucracy and not let it bear them down. He was a master at navigating bureaucracies, and there was something to learn there from a leadership standpoint. John Fickey is the second from the left, and Dr. Fickey, he was Army guy, but he spent some time as our director of surgical services. He's chief down at Hopkins now. He's the surgeon in chief at Hopkins, I believe, or Maryland. No, Hopkins. he was the type of guy, he was like your classic servant leader, right? Like, I'm going to take as much call as everyone else. I'm going to do massive clinics like everyone else. And if I do it, others will follow. And he had that kind of leadership style. Bill Henriquez, who I know some people in the room will know, he led more from a humanitarian. Don't think about you. Don't think about the system. Don't even think about the patient. Think about the community at large and how we can do the most good. And that inspired a lot of us. And the guy on the far right, no one knows, that's Rob Ruland. And if Ficky was a guy who led from the front, I like to say Rob Ruland was a guy who led from behind, just pushing everyone forward. I'll stay back. I'll cover it. You go take this opportunity. You go take that opportunity. I'm the one who's going to kind of carry the load so you can rise. The true leading from behind, which was also absolutely impressive for me to learn. And so, I thought about leadership, and this was my passion, right? Education was my passion. So I went from orthopedic surgery academic curriculum coordinator. I became the director of the medical students, eventually the internship director, eventually the program director. And as program director, I was 2 years in appointed to be one of the members of the Tri-Service GMESB board in Washington, D.C. This right here. I'm going to walk again. Don't get mad. You know what this meant?
Committee.
It was a committee, but you know what else it meant? I was now Captain Miller's boss. I was the one now deciding who went where, who had to go to Okinawa, who didn't, and no one could tell me otherwise. And that was a really good feeling when I approached him and told him that I was now going to help him. And, again, when you... So the beauty of leading in your area of interest and really focusing on what you love to do is when your captain comes up and says, hey, Tony, I need you to join the OR Safety Committee, I had the ability to say, no, piss off. I'm way too busy leading our educational, and he couldn't tell me anything else, and that was a really good thing. The military was a great time to learn to collaborate, right? I got to assist in cases I never would have done otherwise. I got to bring in other people to help me, which created innovation. And I got to engage intellectually with those outside of my system. And I got to collaborate at a time where it absolutely didn't affect my paycheck, because when you're in the military, you're just kind of salaried. And so, it was cool. It really worked out. This is a picture from Officer Indoctrination School, where they kind of put us through the mill and march us and drill us. And these are two of my good buddies. The guy all the way on the left is a guy named Lou Tumialan. He went into neurosurgery. We trained together in OIS, and then we came in together as staff at the Navy in San Diego. And one day he called me into his OR. And he said, hey, Tony, who's starting to do MIS spine surgery, which now I know is a lot of people do it, but it was pretty novel back then. And he's like, and I was spine surgeon at the time. He's like, hey, do you ever have a hard time closing this fascia? Because it's really deep down there and I can't really get in. I want to close the lumbar fascia. And I was like, I don't do MIS stuff, man, but I know that sports guys got this cool little thing that passes sutures. And I was like, why don't we grab one of those and see if we can stick it down there and use that to close it? And I'll teach you how to do some sliding knots, because I remember enough sports. Now I couldn't do a sliding knot to save my life. But back then I could do a Tennessee slider or whatever it was. And we did it. He thought it was so cool, and then we did it for a couple other cases, and then we just wrote it up. And then he's still using this apparently at the Barrow Clinic, which is a pretty prestigious neurosurgery institution in Arizona. And so, got a neurosurgery publication out of it. Go figure. I don't know. This is Rich Manos. Rich Manos was an adult spine surgeon, and at the time, we don't do this anymore. Anterior spine surgery for isolated lumbar curves was a big thing. If you had, probably still a little bit when you trained, less when you trained. Certainly when Jay trained, we were doing anterior surgery, but you just go end to end and you do a fusion. And the problem was I didn't have an approach surgeon who was comfortable doing the kind of thoraco-abdominal approaches for me to do that. But Rich Manos was doing XLIF surgeries for his adult patients with degenerative spine. And I'd look at his post-ops, and if you put it a little eccentrically, kind of tilted the spine one way or another. And I said, I want to fuse some lumbar curves. I don't have an approach surgeon. We weren't doing posterior at the time. It's like, you think we can apply this XLIF thing to, and he was like, and put it eccentrically? And so we've got the first series of isolated lumbar curves treated with anterior only spinal fusion through an XLIF, and we never would have done that if we hadn't collaborated again in a system that allowed us to do that. And of course, because I was in San Diego, I got to meet friends outside of Scottish Rite in the San Diego group, and they were super warm to me, and that's taught me that no matter where anyone comes from, if they do what you do and they need help and they're by themselves, or they just want academic and intellectual exchange, you got to provide it to them, because they provide it to me, and I'm forever grateful. The other thing I found is that you have to take advantage of change, because change, right? Change is an opportunity to keep learning. And there was a big change that happened for me about a year and a half into my time in the military. And that change was that we went into Fallujah as a surge. The Fallujah surge happened. And simultaneously, just a couple months after that, we moved into Afghanistan. And all of a sudden, day after day, we would get anywhere from 6 to 10 to 15 injured servicemen and women coming over with the most horrible injuries you've ever seen: blast injuries, IEDs, vehicular explosions, and it was some of the hardest stuff I ever had to stomach. And when this starts happening, all of a sudden you realize what your job really is when you're in the military. These Many of these servicemen and women went on to amputation. We couldn't salvage their limbs. They would come in grossly infected after being exfixed out in the field. Some of them just came with amputations already done. Now, when this happens and this comes in such high volume, and the pictures really don't get any better for the stuff we were dealing with at this point, when this happens, the military doesn't let you do elective surgeries anymore. The ORs are completely dedicated to what we're really there for as military surgeons, which is saving the lives and limbs of our servicemen and women. So you can't do total joints, you can't do peds. I couldn't do it. They shut it down. All we could do was take care of injured servicemen and women. And because I was the only pediatric surgeon at the time at the hospital, I was also not deployable. They couldn't send me to the field no matter how many times I asked to go and be a part of it. All my other partners had to go back and forth and deploy for 6 months, but I was what was considered an essential billet. You're the only peds guy. You can't do peds, but you still can't go out to the field, right? I mean, learning how to work inside of bureaucracy, and I tried and I couldn't make it happen. So it became really important at that point that I develop a new skill set, because I was the only constant factor for the next 3 years during this war, during the 2 wars. I became de facto the trauma lead, with having a very marginal trauma experience, to be perfectly honest with you, in my residency, especially for high energy, bad blast injuries. This guy, Mike Masaryk, was one of my partners. We had 2 trauma surgeons, and he said, "Tony, I know you're stressed about this," and I was, because I felt really underwater. And he's like, "We're just going to do as many cases as we can before I deploy. We'll do as much as we can together. I'm going to get you up to speed on periarticular stuff. I'll get you up to speed on at least provisional fixation of pelvic ring injuries. And I'm going to try to get you to a good place. You already know ring fixation and segmental bone defects from Scottish Rite. And that way, you can kind of be the constant factor till I get back and the other trauma guy gets back." And I was like, fine. And I call that my second fellowship, because then for the next 9 months, all I did was some of the most complex extremity trauma you can imagine, alongside a guy who was always in the next OR who could come and teach me and help out. And that's really where I learned to do trauma, guys. Like I didn't leave residency as much of a trauma surgeon. And we did really cool stuff like complex periarticular work and segmental bone loss. And because the war generated so much enthusiasm academically within the trauma world in the US, here in Canada, the metric study, I assume the orthopedic residents are familiar with the metric and LEAP study. There's a limb salvage studies. All of it came out of data from our injured servicemen and women. And as a metric center and one of the 3 leaders of trauma in the entire military, because the West Coast was San Diego, the center of the country was San Antonio, the East Coast was good old Bethesda. I was the lead. And so I got to work with all these really preeminent traumatologists and develop protocols to study it. And this resulted in massive DoD funded. It resulted in a ton of research. I got to present this research at the OTA. I was on boards at the OTA. I became a legitimate or I was considered, I wouldn't say I was, at least they considered me to be a trauma expert. And I was on every panel that talked about blast injuries moving forward. And it resulted in really cool research. We got to kind of use the funds to kind of study the best ways to do amputations. And we did a lot of limb salvage work versus amputations. We got to study the results of these things in a motion lab, which they built for us. I personally got to work and develop rehab programs for our amputees. I told you I'm a surfer. It's a blurry photo, but that's me on the edge right there. And we developed a whole rehab program to work with our amputees and get them out and surfing to kind of enjoy what San Diego had to offer, similar to the amputee ski trip you went on it. And in reality, this was really easy for me because I was used to being at Scottish Rite and taking care of kids who had amputations and helping them rehabilitate. So that was just really personally rewarding. And if you think about it, as I think about it in retrospect, at the time I was a little stressed out, but there's really no difference between a 22-year-old Marine with a high velocity gunshot wound and segmental bone loss than there is about the 13-year-old kid who rolls his ATV over and tries to rip his leg off, right? They're both missing bone. They both have the potential for infection. You need to do aggressive debridements, get everything that's unhealthy out of there. You end up with a bone defect. You have to find a way to fill that defect. And I really was grateful for getting to use the skills I learned from one of my mentors, John Birch, and how to deal with segmental bone loss with bone transport. And you could do amazing things. And all those principles I was able to apply, or we were able to, as our team, apply to the military population. As I said, we're doing a lot, and I became, without even trying, some kind of trauma expert in the adult trauma world as a result of this. And Tony Herring found out about it, and at the time they needed someone to run trauma at Scottish Rite, as Kevin told you. This led to me being brought back to Scottish Rite, which I always loved. We wrote a lot. There wasn't a lot of peds trauma research happening at our institution, so we got the opportunity to write book chapters and do a ton of research. We reviewed at least one of those articles last night. And as a result of that, we got to really inspire fellows to kind of then be excited about trauma, whereas at Scottish Rite, most fellows were coming just to learn how to do cool spine surgeries or maybe foot and ankle or lower extremity reconstruction. And, we've had great fellows over the year. Here they are. This is 2 years ago. They're jumping for joy clearly at the trauma education we're providing them. Others were a lot less interested in, they wanted to learn more about the beer pong offerings. And so Kevin mentioned this is what it looks like. And I got to tease him now, Kev. He ran towards every educational opportunity with grace, by the way. I mean, look at that, right? I mean, fleet of foot. Unbelievable, man. Had 3 chins at that point? My buddy Maz deployed eventually. I was on my own. And Maz went out, but Maz didn't come back. I think, I know, the hardest thing I ever had to do in my entire life was receive the flag that was covering Maz's coffin and give it to his grieving mother. And that's something that'll stick in my head kind of, forever. He was a dear friend, but he also, and I didn't know this at the time, launched my whole career and what I would become by taking me under his wing and teaching me how to do adult trauma in a very difficult environment and a very difficult time for our country politically. And so, it started back when I decided to join. And I started out, I was broke, I was pissed at a fat kid, and I was totally in it for myself. And, in 2010, when my time came up, and it was just time to get out. And I had been offered the job back at Scottish Rite, which I thought was a great opportunity. I was definitely less broke. I was still pissed at the fat kid. I always will be. But I realized after everything that had happened and the sacrifices, especially Maz had made, that, it was never really about me as I thought it was in the first place. I was way better off when I started, but, a lot worse for the wear, right? The forehead's only continued to expand. The Navy haircut that I didn't want to get shows off these honking ears I got, and 3 medals. Come on, I should have gotten more than 3 medals. But I bring you back to this DD-214 form. So Here's the thing about a DD-214. No one here knows the U.S. military. When you have a DD-214, this doesn't mean you leave the military and come back. This means you're out of the military. And so, when I showed up to check in San Diego, really apprehensive and remembering the negative times I had at Bethesda, the enlisted guy who was kind of checking me in, he said, there's a DD-214 on your file. I was like, yeah, I know. I was in at Bethesda. I did an ortho residency. And he's like, yeah, but like, I can't check you back in. You don't have any obligation to the military. You have a DD-214. I was like, yeah, but I owe 4 years. And he's like, doesn't matter. That all got eliminated when they gave you this paperwork 4 or 5 years ago. You can walk out of here and go home right now. And again, you got to remember, I'm thinking about Captain Miller and everyone who screwed me over. And so, I thought about Jack Delahaye, who said, remember what you're there to do and don't be a dumbass. I'm thinking, if I do this, are they going to come? If I literally don't serve the time I'm owed, is someone going to come and like arrest me and throw me in military jail or something like that? And when I walked into the department, because I was looking for direction from anyone who gave it me, who'd I run into that day but Mike Mazurek. And Maz looked at the DD-214. He said, you should leave right now. If you don't take advantage of this, you're a huge dumbass. Leave. Do not join the military. Just go. And obviously I didn't take his advice. But, I talked about beginning at the beginning and going on till you come to the end. And we said this was the beginning, and this really was the beginning. But the truth is that could have been the end. Right there, I could have walked out. And if I had done that, in absolutely no way, at least I believe, would I be here like educating and talking and convening academically with friends in Canada and other countries and across the United States. So I personally am really glad that it wasn't the end, even though a dear friend of mine, or a man who would become a dear friend of mine, advised that it should be the end. So if you paid attention, you saw some pictures of anchors. There was at least one admiral in this talk right there. And the only a-hole is really the guy who's been sitting up here for 45 minutes talking about himself the whole time. So I'm going to leave it at that. But before I do, I absolutely, it's a real honor, guy. It's a huge honor. It's an absolute honor to be asked to kind of be here, especially with dear friends and people who are extraordinary colleagues and smarter than me, and Dr. Willis and Dr. Jarvis, guys who I've revered for quite some time. These guys never actually played beer pong against each other, so I had to kind of, this is what it would look like. I'm not sure who'd win. You got the brawn and bulk of Smith, and you got the wiry speed of Tice. We'd have to ask Jay Jarvis to commentate, decide who he might predict. But huge thanks to you too, because that's the guy right there who established the real connection between Scottish Rite and Ottawa, and it's endured for all these years. And I hope it's special to you guys, but it's really special on the Scottish Rite end. So thank you so much. If anyone has questions, I'm happy to take them. Appreciate it. Good. All right.
Any questions?
We'll have more questions with the clinical talks when I get to actually talk about medicine, I hope. Yeah. Hey, then I'm going to get a cup of coffee.
Yeah. And
Told you it was more of a TED talk and less of a. I told you guys. Yeah, okay.
Experience brought you to Pete. You had a lot of adult experience, military exposure, all that. What, other than obviously your fellowship, what drove you towards a pediatric?
It was strictly mentorship from one individual, Jack Delahaye, who I referenced. He was at Georgetown. He was a pediatric orthopedic surgeon, but again, he wasn't an academic. He was academic in the sense he's the best teacher I've ever had in my entire life, and I'm talking undergrad, elementary school, the best educator. And he taught me that, and I firmly believe this, and not to insult anyone who doesn't do pediatric orthopedics, but you think about joint replacement surgery. You got arthritis, it hurts. We've tried NSAIDs, we've tried injections. You get a joint replacement. That's mentally, that's a pretty easy thing to get your mind around. I was making fun of Sasha last night. You know, ACL is disrupted. You want to keep playing soccer? We're going to do your ACL reconstruction. PEDS is much more nuanced and complicated in kind of breaking down kind of complex deformities into manageable bites and then applying principles to correct those deformities. It's not the ACL is out, we replace the ACL. There's a lot more that goes into it. And you have to consider patient factors more often than I'd say other parts of orthopedics, the syndromes, the things that put kids at risk for failure wound healing problems, the tension of the soft tissues in kids, say, with arthrogryposis when you're doing acute corrections and what that can mean for the neurovascular structures. I just honestly found it so much more intellectual than not that I'm intellectually arrogant because I'm kind of stupid, but I just found it much more intellectually complex, and that's why I went into it. Yeah.
Along those lines, you mentioned a lot about education, and I've had the opportunity. What is it that makes, like, we have a lot of residents and staff here. What makes a good educator, especially in kind of an orthopedic training program?
Oh, oh my God.
It's another talk, but
that's a whole other talk, right? How to be a good educator. First of all, like, I firmly believe you're not going to be good at anything you don't really enjoy doing. So I don't think you can force yourself to be a good educator if you're just not interested. If you don't love teaching and if you don't have the capacity to kind of carry patience into everything you do, because you have to be really patient when you're working with trainees, then just don't do it. You're not doing yourself any favors. You're not doing the trainees any favors. So that's number one, is take a good hard look at whether or not it's something you really enjoy doing. And if you really enjoy it, I think the trick to being a good educator, and this gets nuanced and philosophical, but we all have knowledge gaps, right? Every single one of us in this room has knowledge gaps in those of you in orthopedics or surgery or whatever your pediatrics, whatever your specialties are. But the problem with knowledge gaps is we don't always know we have them because they're gaps, and we're not usually, as we're training, we're not smart enough to identify. We know what we know, but we don't know what we don't know. And so the real trick to being a good educator, I think, is to empower the trainee, the resident, the medical student, the fellow, to be introspective and say, okay, we're doing this surgery and we've done it once or twice before. I know you know what you know how to do, but let's talk about the areas that confuse you. Let's talk about, like, things you might not be telling me you don't understand because you're too embarrassed to do it. I empower the trainee to be introspective and identify their knowledge gaps, because if they do it themselves and they present it to me, then I can assist them in filling that gap, and then we can move on to the next one. It's fundamentally the reverse classroom model, but I think those who have been really successful at educating, at least the people I've looked up to in the education arena, they've empowered the trainee to identify their knowledge gaps and then present them to the staff, who can then assist them. And then once that's done, they identify the next one. It's a never-ending process. Does that make sense? Yeah. Well, I really appreciate this, guys. Thanks for the opportunity to share the story, I guess.
So we'll take a quick break. We'll have the honor and opportunity to spend the day with Dr. Riccio. For the rest of you, you're more than welcome.